Many soon-to-be moms start taking prenatal vitamins as soon as they learn they're pregnant. Now, a new study says those supplements don't actually benefit growing babies, and the money could be better spent. To tell us more is CTV's medical consultant, Dr. Marla Shapiro. She's with me in studio. Good morning, Dr. Marla.
Good morning.
How did researchers come up with this?
Well, we've known for the longest time that nutrition is critically important in the prenatal exposure period, so just as you're leading up to becoming pregnant and certainly throughout the pregnancy. And if we look at what the deficit of nutritional vitamins and nutrients has been linked to, there's quite a bit that we do get concerned. So that's been the basis. So you can look at this. Preeclampsia, which means high blood pressure during the pregnancy itself, fetal growth that's restricted, something called neural tube defects, spina bifida is one of them, deformities of the skeleton itself, and low birth weight have all been linked to nutritional deficiencies. And that spawned a lot of the data that's been collected to look at what vitamins are needed. And that's the first question, that many of these studies have been studies that are observational, and they've been carried in countries where there are more third world issues in terms of nutrition. So that means that that data, when reviewed most recently, was looked at in terms of a North American population, and does that data hold true for us here in Canada?
Interesting. So what are women to do now? Because as we pointed out, many women, as soon as they find out they're pregnant, they start taking these supplements.
And there's a lot of marketing that goes onto these supplements, and a lot of them, there's a myriad of lists if you look at what's in them. But if you really look at what the data shows us and where the evidence lies with folic acid, very important to have pre-exposure, meaning pre-pregnancy and during pregnancy. But the amount that we typically look at is about a 400 microgram dose available in most of the prenatal supplements. We only recommend higher doses if you've had a personal history of a neural tube defect, or there's a family history, or in some cases of women with diabetes. And the second vitamin or nutrient that actually has evidence for use in pregnancy is supplementing with vitamin D. But again, if you're having adequate dairy, most of our dairy is supplemented or fortified with vitamin D. So the reality is that a lot of the very expensive nutritional supplements that we sell to moms and market to moms we're marketing to a crowd that, of course, wants to do the best for their unborn baby and absolutely, wants to follow it. But if we look at where the evidence takes us, we do know that the folic acid, vitamin D, both inexpensive supplements, are probably all you really need if you have an adequate diet.
What do you tell women who want to be pregnant or are pregnant about their nutrition?
So I think that the first part of your question is really where we want to aim that discussion. In other words, planning for pregnancy, thinking about a wanted pregnancy, looking at our nutrition. Do we have adequate dairy, calcium, vitamin D? Do we have adequate sources of folic acid in the diet, or should that be supplemented? That's one of the usual supplements that we talk about. Is your iron intake adequate as well? Because typically what happens is that the baby will take what the baby needs from you, and you may end up having low iron as a result. But certainly in terms of folic acid and vitamin D, those are the two where the evidence lied. And whether or not you require more, as always, this is a review of the overall evidence. You as an individual, you're going to have that one-on-one conversation with your physician, looking at your nutrition, your individual health status. For example, if you're diabetic, those rules will change for you.
Okay, Dr. Marla, thank you so much. Appreciate it.